Dearest Gist Partner, I just finished to read this paper. So this paper na about researchers wey go for one hospital for London to go research whether healthcare professionals, and in this case obstetricians and midwives, whether they follow the current UK law on consent. So they wan see whether pregnant women wey carry belle dey go hospital, say whether these women truly dey make autonomous decisions about their health and their baby and their pregnancy. Say they don't hear speculation say some kind things dey happen, but they do observational study where we say they carry their person put inside those consultation rooms to see how these conversations they flow and how women they make decisions. They can't notice say their observations, they categorize them under 4 things. Then first thing I say clinical framing. They say with this, say sometimes conversation about women health and decision making, the kind way where the doctor they present and it be like say they don't already make decision for the woman and now for the woman to say yes or no. Say the kind of framing, the introduction of the matter self, it don't already narrow the woman point of view. Say make them they more open to reasonable alternatives. Say when they present this kind of matter, make them open all the cards give the woman. Number 2 thing na say clinical risk dominated narrative. This one na say they talk say for this consultation, say the doctors go start to the point to the risks associated to waiting they want do for the woman. Say for instance, woman want do cervical cerclage, where we say they will put sutures for the woman cervix to reduce the possibility of miscarriage. Say when they talk about issues like this, any other procedure or any other thing at all, say they go start with the risks. Say make them know they do like that. Make they first of all bring out all the options available to this woman before they start to talk about the risks, the advantage or the disadvantage. They can also notice say not many of the doctors and midwives they check for understanding. Say when they talk about all these things, they know they ask the woman, do you understand? Okay, which side where you don't understand, where you need me to repeat? You feel if I tell me teach me about this thing why they talk now, you go fit talk and give your husband when you reach house or your children. Do you understand it for yourself? Say they know they check understanding. Say most of the women for those consultation rooms, they just they nod, they just agree. Another thing where the third thing I say parallel narrative. This one I say some of these decisions they streamline them to the woman's experience in the hospital. Say in the actual sense, say most of the women we talk to them, they talk about social factors like who go stay with them for hospital, how they are settling in at home go be. Say when they make decisions, may they also inculcate those kind of social issues enter the matter. Then the last one, they say make this conversation be cross-court narrative. Make it be the doctor they talk, the patient they talk, make them rub minds together, because according to this UK law of consent, the doctor is supposed to explain the risks. It's supposed gauge the woman understanding of the risks. It's supposed rub mind with the woman when she don't make decision about waiting to do. Say when if patient come out and say, oh nah, this one why I go do, say the doctor is legally responsible to make sure say that decision where you make now for your good. Make I quickly read you one thing why I see for here. Nevertheless, as a matter of law, a doctor has a duty to take reasonable care to ensure that the patient is aware of any material risks involved in any recommended treatment and of any reasonable alternative or variant treatment. Another thing about this law, I say the woman must get capacity to make decision. So you see, make I read you the title of this their paper. The title now, Consent in Pregnancy, an observation study of antenatal care in the context of Montgomery. make I gist you about this Montgomery, wetin e mean. So for 1999 for Scotland, a woman wey her name na Nadine Montgomery, she go hospital to deliver her pikin. Before that, her doctors don notice say this woman get diabetes o, this woman dey petite, and the pikin wey dey her belle don big well well. Given all of this, the doctors dem no tell this woman say, madam, this is the situation and these are your options. The doctors just make decisions for this woman because they feel say if they tell the woman wetin dey happen with her baby and everything wey dey happen, she fit unnecessarily decide to do cesarean section. So based on wetin they call Bolam test, where be say a doctor cannot be held negligent because how they take quote that in, a doctor cannot be held negligent if another doctor in that same scenario go do the same thing. So based on that Bolam test, they can't say now based on that, now they don't look the woman say she go fit try labor. So this woman, they carry am, she enter labor room, she try labor. During the process, because her pikin big now, the pikin can encounter shoulder dystocia, where be say in carry in shoulder won't take come outside. In that process, oxygen supply cut off for a few minutes. The pikin can develop cerebral palsy. The woman can't come out. She say, I no go gree, I go court. Why be say una see all of these things, una see my health condition, una see the situation of my baby, una see the position of my stature as a woman, una still let me enter to try labor. I am gonna sue you people. She sued them and she win. For 2015, the court of law can say, oh yeah, we are not gonna be relying on the Bolam test again. Any decision where you want make for woman body based on informed consent, it cuts across. Say the patient must be involved. You must discuss with the patient to gauge their understanding, know where they stand. It has to be patient-centered decision. The woman win. From there, they can say it go be the Montgomery standard. Now, in these people go London to go see whether healthcare professionals they follow up. Now, I can say make I see whether we get similar law for Nigeria. I check, we get the National Health Act of 2014. You know, say as I can't enter the rabbit hole, I can't see say for a long time, say healthcare sector, they run on okay, the doctor sabi what is best for you, and so the doctor go decide and then the patient go follow. Until 2015, where for Goodluck Jonathan administration in can sign am into law, say that's Health Act, it get a lot of things, but informed consent follow the inside. You know, say this law they've been proposal since 2000, over a decade. 2015 9 Goodluck Ebele Jonathan consign 2014 9 Goodluck Ebele Jonathan consign. So this video now to tell you, say if you dey go hospital and you won't do any procedure, you won't do anything for your body, you won't do anything for your health, doctor no go fit come carry paper tell you say oya sign this, sign your signature here. No, say doctor go sit down with you, discuss options where they are available, help you choose the most one wey go benefit you go, and you dey allowed to ask questions, to ask how it go benefit you, to talk about your past experience, your past medical history, all of these things. The reason I dey make this video, and I say me I dey very passionate about women's health, and most times pregnancy na vulnerable state for a woman's life. You go see say woman where they very vocal, she dey audacious. If you reach that period, she go just cool like ice water. But I want to say for that situation, ask questions. Ask questions, open your mouth and ask questions. Rapport with your doctor, rapport with your midwife. Tell them, if I do this and do this and do this, how it go fit benefits me? How it go fit benefit the baby? How it go fit benefit my recovery? I love you very plenty. I go put a screenshot of the paper. You go feel dey interested to read am.